please state your name, who you represent, and your position on the issue?
Yes, good morning, Madam Chair, members. My name is Steve Wohleb. I'm the General Counsel of the Texas Hospital Association. And on behalf of our over 450 hospital members, I'm here to testify today against House Bill 1164. Placenta accreta spectrum disorder is extremely serious, as we heard from Dr. Olafson earlier and Ms. Reed. And we appreciate the focus and attention that this bill gives to this potentially life-threatening condition. To be clear, we are not against the overarching goal of the bill, only the method to achieve that goal that is set forth in the bill. Fortunately, in Texas, there are many excellent physicians capable of correctly diagnosing the disorder and working with the woman to determine the best plan of care and course of treatment, and many excellent hospitals with the resources to support that treatment plan and potential complications. And the existing perinatal regulatory framework is not only adequate to ensure these systems are in place, but its robust maternal and neonatal level of care designation scheme represents the gold standard in leadership and commitment to reducing maternal mortality and morbidity. As many of you are aware, in 2013, the legislature passed legislation to establish a regional perinatal system with statewide scope to improve birth outcomes for all babies and mothers, including women at risk of or diagnosed with PAS. As required by that legislation, the Department of State Health Services, in consultation with the Perinatal Advisory Committee, established hospital levels of care for neonates and mothers, requiring all hospitals that provide these services to obtain a level of care designation based on their clinical capabilities. Maternal levels of care took effect in August of 2020, requiring hospitals to be designated as one of 4 levels, ranging from level 1 basic to level 4 advanced. There are currently 21 level 4 maternal facilities that are required by their certification to be able to provide the full range of care for pregnant and postpartum patients, from low-risk conditions and to the most complex medical, surgical, or obstetrical conditions that present a high risk of maternal morbidity and mortality. The 17 facilities that have received level 3 designation must each be able to address significant complex medical, surgical, and or obstetrical conditions that present a high risk of maternal morbidity or mortality. So instead of creating centers of excellence and a new regulatory scheme focused on a single disorder spectrum, we think a better approach would be to continue to rely on the Perinatal Advisory Council to shape the state's policy and approach to ensure that there are facilities that can manage a wide array of maternal health disorders without specific references to this or any other particular disorder or condition. If they deem it appropriate, the PAC can recommend rules to the Commission within the existing maternal or neonatal designation framework related to criteria to address specific conditions. We would also point out that there are other mechanisms to educate and inform physicians and hospital staff about this and other serious maternal health conditions and to promote excellence in care for pregnant women. Texas AIM, a collaboration between our association and the Department of State Health Services, is a quality improvement initiative that has focused on safety bundles to reduce rates of inpatient maternal mortality and morbidity. The first bundle, in fact, was related to maternal hemorrhage, a significant risk of PAS, and 98% of Texas hospitals that deliver babies participated in that initiative. So Texas AIM is another vehicle through which a focused initiative around PAS could be pursued. Again, we appreciate your continued focus on Texas leadership in reducing maternal morbidity and mortality. We share the same goal of making sure that the high-risk pregnancies and all pregnancies in Texas receive the earliest, best, and highest quality of care, and we look forward to working with you all on the great work that's being done in this area. Thank you.
Members, any questions?
Yes.
Representative Collier.
Thank you, Madam Chair.
Good morning.
So I just want to ask, are you aware of the rate of deaths associated with maternal mortality and where Texas stands in the nation?
I'm not aware of those specific statistics.
So in 2018, Texas ranked 43rd out of 50 for our rate of maternal mortality. That's a very, you don't want that. We don't want that number. We want to do anything we can to improve health outcomes. And if this is a measure that we can do, which we heard, this is a possibility that this we can reach better outcomes for our Texans, then we need to do this. So Is your opposition because of the cost? Is your opposition because you don't want to be recognized for being a center of excellence for this type of care? Or
Well, really, it's neither. No, that statistic is not acceptable, and we support any initiative that could tend to improve that. We simply believe that the existing framework in Texas, the Perinatal Advisory Council, that has extremely qualified individuals, very capable of implementing criteria around this or any other particular high-risk maternal condition, is in place. It exists. It works extremely well, we think, and would be the mechanism to pursue improvements in the area of the treatment of this condition and
well, if they could have done it, they should have done it already. So it hasn't happened. So we have to take legislative action to make it happen, apparently. My concern is that there are people in rural areas who don't have access to this type of care, and this bill would provide an opportunity to have even telemedicine. I hadn't even been a big supporter of telemedicine, but I see the need. There is a greater need for this, especially in the rural communities. So I'm having a hard time wrapping my head around your opposition to something that's very much needed across the state to improve health outcomes. But I appreciate you being here.
Thank you.
Madam Chair.
Representative Guerra.
In echoing Representative Collier's comments, all I can say is what you're doing ain't working. So I don't understand your position on this and your organization's position on this. It ain't working. And we're losing too many lives over this. I'm from the Rio Grande Valley, and I can tell you this is a serious issue. And I really appreciate Representative Oliverson's proactiveness in trying to do something about this. More specifically, do you have any suggestions or any recommendations beyond what Representative Oliverson has presented? It makes sense to us and to me.
Yes, Mr. Vice Chair, I think this bill is certainly a start, and could be the spark that leads the Perinatal Advisory Council to take a look at this issue specifically. And if it thinks that there needs to be modifications or tweaks to the maternal level of care designation criteria, I think this is the opportunity for them to do so.
Well, I don't understand. This bill is the catalyst to wanting to do something about this when we've known about these large number of deaths that are occurring throughout Texas. I don't understand your comment, so I'm looking for clarification. Now we want to do something. Is that what you're saying?
Well, I think I don't disagree with that completely, because I do think there is great work already happening in the 21 level 4 level of care designated facilities, maternal designated facilities in this specific area and in other areas. My comment was simply that this could be a catalyst, but I think that work is already being done. We are not, as a state, where we need to be globally in the maternal health arena and reducing maternal mortality and morbidity, but there's good work being done, and I think that work just needs to continue.
Well, I appreciate your comment that there's good work being done, but again, it ain't good enough. Thank you.
Members, any other questions of the witness? All right, thank you.
Thank you.